today I'm going to talk to you just like I did a couple years ago about advanced care planning. As the holidays draw near, our thoughts and our hearts begin planning those special gifts we want to give our loved ones. A gift that will be meaningful, helpful, insightful, and lasting. How many of you in this room have an advanced directive? Wow, that's a pretty good percentage. That's a great percentage. I'm here today to suggest that one of the greatest gifts for those that you haven't, that you can give your family and other important people in your life, it can't be worn, driven, or consumed, and it's not flashy, it's not costly or sexy, but it often brings the greatest or greater peace of mind that you can ever imagine. What more can you ask for in a gift? And the gift that I'm referring to is an advanced directive. Not just because we have gathered today as seniors, because I'm one, and I'm thinking real hard about my director. It really is meaningful to everyone. Advanced care directives are a helpful tool for any age. So for those of you youngsters in the room, this topic is important to you as well. Many of us plan and will live a long, vibrant life. So this isn't a Debbie Downer kind of a document. It's part of maintaining that healthy, vibrant life. However, if someone should happen to impair our ability to speak on our own behalf when a healthcare crisis occurs, our loved ones will be much better equipped to handle this situation if your wishes in advance have been discussed and documented. It starts with the conversation. That is the most important part, long in advance for some people of putting the advanced directive together. And it may require another conversation and another conversation. And you may want to consult with your healthcare provider. I strongly advise that, about the various options available for treatments. And as a little side note, Dr. Gardner even suggested this morning, because he knows us so well at hospice, that you might even take it a couple steps farther and let your provider know that when the time comes, you want to be on hospice to make it much easier for your provider and your loved ones. You may want to conduct your own research, especially now, these days, with so much technology and so much advancements in healthcare. Think about questions like, do you want to be hooked up to machines? Do you want to continue treatments that may or may not be comfortable? Do you want to keep going to the hospital? Your life, your way, and you have choices. The conversations and consultations are so important. Then, the next most important part of your gift is picking someone to be your healthcare representative. Oftentimes, healthcare representative, proxy, many terms, that understands and supports your wishes. So if a time comes, suddenly, when you can't speak for yourself, they can speak on your behalf. An advanced directive, that is the culmination of your conversations, research, and some decisions, will be the tangible gift that you give. And the nice thing about it is you can change it anytime you want. It's not complicated. It takes some thought. It's not complicated. And it can be updated anytime. So here at Hospice Services, we strongly support and actually try and promote advanced care planning so that our senior community and everyone else in the community can really maintain or work towards maintaining the highest quality of life possible. And that's why we always promote your life, your way. That, again, not here to talk about hospice, but that also moves over into a period of time when people are deciding about seeking treatment or not seeking treatment. We encourage that kind of thoughtful conversation in your advanced care planning so that you can have that conversation well in advance and you don't wait too long if the time comes where comfort care is right for you or possibly right for you. So if the circle of life has a beginning and an end, and we acknowledge births, anniversaries, marriages, graduations, and more and more and more, and we at Hospice also want to celebrate the end of life for all of you. That includes peace, comfort, hope, and dignity. Having an advanced directive supports a smooth transition if and when the time comes for you. Sooner is better. If you have questions about advanced care directives, we can help you. We have a table over in the vendor area. Every one of the major healthcare agencies in our community are signed on to the Your Life, Your Way initiative. You call anytime. So thank you for letting me talk to you about advanced care planning today. And I hope, before I say, hope you enjoy the rest of the Senior Summit. We have the tools for conversation available and a directive available. So please stop by the table and pick one up. Enjoy the rest of your day. Thank you.